Today, we're diving into a condition called hidradenitis suppurativa, or HS for short. For millions of people, it's a daily, painful reality. But what if I told you this skin disease was actually a warning sign, a signal from your entire body?
You see, for the longest time, many people, even some doctors, have kind of dismissed HS as just a really bad skin problem. Painful, recurring boils that show up in skin folds. But that's like looking at the very tip of an iceberg. The real story is so much deeper and way more complex.
So yeah, that's the big question we're tackling. What if these skin lesions aren't really the disease itself, but are actually the most visible symptom of this firestorm of inflammation that's happening all throughout the body?
All right, so to really understand what's hidden, we first have to get a good look at what's right there in plain sight. Let's break down the classic, visible signs of HS that patients actually live with.
So here's how it usually plays out. It starts with these incredibly painful, deep lumps called nodules. And I mean, these are not pimples, they're serious inflammatory lesions. They tend to pop up in places where skin rubs together. Think armpits, the groin area. Over time, things can get worse. These spots can actually connect under the skin, forming these tunnels called sinus tracts, which can drain and lead to really severe, life-altering scarring. Doctors even have a grading system called the Hurley stages to classify how severe it is, from stage 1 with single abscesses all the way to stage 3 with these widespread interconnected tracts.
So for a long time, the big question was just why? Why does this happen? The old way of thinking was that it must be an infection or maybe a hygiene problem. Well, we now know that's just plain wrong. The real culprit? It's a case of mistaken identity by your very own immune system. It's basically a chain reaction. It all kicks off when a hair follicle gets blocked up. Then that blocked follicle swells and eventually bursts, spilling everything that was inside it out into the surrounding skin. Your body sees this and completely freaks out, hitting the panic button. That's the inflammasome activation. This sets off a massive inflammatory response with all these specific immune cells rushing to the scene. The crucial point here, the thing you have to get, is that this is an auto-inflammatory process. The body is literally attacking itself.
And get this, it isn't just random. A huge piece of this puzzle is genetics. Somewhere between 30 and 40% of people who have HS also have a close family member with the disease. That tells us right there that there's a pretty significant inherited component to this.
In fact, for some people, HS doesn't even show up alone. It can be part of this whole group of inflammatory conditions, like something called PASH syndrome. PASH stands for pyoderma gangrenosum, acne, and hidradenitis suppurativa. Seeing HS linked up with these other really severe conditions was a huge clue for scientists that we were dealing with something much bigger than a skin-deep problem.
Okay, this is where everything starts to connect. That chronic, smoldering inflammation we just talked about under the skin, well, it doesn't just stay there. It sends out ripples, affecting organs and systems all over the body.
Just take a look at these numbers. They're staggering. 50%, half, of all patients with HS deal with central obesity. 40% have high cholesterol. 35% have high blood pressure. Altogether, these things make up what we call metabolic syndrome, and how common it is in the HS community is just wow. This is not a coincidence. That systemic inflammation from HS is a major driver of these metabolic problems. And that ripple effect, it extends to the gut. The very same inflammatory pathways, especially things like the TNF and IL-23 pathways, are also major players in inflammatory bowel disease. And what's the result? People with HS have a 3 to 5 times higher risk of developing Crohn's disease. The gut-skin connection is incredibly powerful here.
And the inflammation can also target the joints. Up to a third of HS patients end up developing spondyloarthritis, which causes this painful inflammatory arthritis in the back and joints. So, let's recap. We've now connected the skin to our metabolism, our digestive system, and our skeletal system. It is truly a whole-body disease.
But the impact of HS goes even deeper than all these physical issues. We have to talk about the profound and often invisible human cost of living with this disease, day in and day out.
This chart really says it all. The rate of depression in the general population is what, around 8%? For patients with HS, it's 21%. That is a massive difference, and it shines a big, bright light on the serious mental health crisis that's been hiding within this patient community.
So why is that rate so high? Well, it's a combination of just devastating factors. The pain is chronic and it's totally unpredictable. The lesions can sometimes have an odor, which leads to intense self-consciousness and social isolation. The scarring can be disfiguring, and all of this can have a profound effect on intimacy, on relationships, and even on someone's ability to hold down a job. It's just a heavy, heavy burden to carry.
And tragically, that burden can become unbearable. An alarming 15% of patients with HS report having thoughts of suicide. Now, this isn't just a number. It's a desperate call for help, and it's a demand for better, more comprehensive care that addresses both the body and the mind.
The good news in all of this is that this new whole-body understanding of HS is completely changing how we approach it. We are finally moving away from just managing boils to actually managing a complex systemic disease. And that, right there, opens up a whole new era of care. Modern care now starts with screening. This red flag checklist is really becoming the new standard. When a patient gets diagnosed with HS, we're not just looking at their skin anymore. We're checking their blood pressure, their cholesterol, asking about gut and joint pain, screening for depression, and just being vigilant for all these related issues. It's proactive, it's preventative, and it's holistic.
And our treatments? They've evolved too. We've moved beyond just antibiotics, which really don't address the root cause. We now have what are called biologic therapies. These are highly targeted drugs that act like guided missiles to block the specific inflammatory signals that are driving the disease. These treatments don't just calm the skin, they calm the systemic fire.
And it just makes sense, right? A disease that affects so many different systems can't be treated by just one person. The future of HS care is a team sport. It absolutely requires dermatologists working side by side with specialists in rheumatology, gastroenterology, endocrinology, and, critically, mental health professionals to provide the kind of comprehensive care these patients deserve.
Ultimately, it all comes down to this single, powerful statement. This is the paradigm shift. Once you see HS as a systemic autoinflammatory disease, you can never go back to seeing it as just a skin disorder. Everything about how we diagnose, manage, and treat it has to change.
And that leaves us with one final, vital question. The science has given us the map. It's shown us the true nature of this disease. The challenge now is to rebuild our healthcare systems and our clinical approach to actually follow that map, and to make sure that every single person living with HS gets the comprehensive, whole-body care they've been waiting for.